following is a paid program. The opinions expressed are not necessarily those of WNBU and Interbanks Media. Welcome to All Things Money with David Blain, a thoughtful and revealing discussion of actionable ideas and effective strategies to help you through the complex world of investing, taxes, and real estate. Now, with All Things Money, here's David Blain.
Hello and all. Welcome to All Things Money. I'm your host for the show, David Blain. Thank you for joining us today. We're on 94.1 FM WNBU as well as cable TV 10 in New Bern, North Carolina. A lot of you also listen to us streaming over the internet from www.dlblain.com, which incidentally, I think this week we've been talking about for a while. I think this week our new website is going to go up and live, and it is really fantastic. We have gone back in the archives for 5, 6, 7 years and cataloged all the TV shows, all the radio shows, all the written articles that we've produced over the years, newsletters, different things. It's all cataloged into a Web 2.0 format that's fully searchable, indexed. It's just fantastic. We've got some good information up there about myself, my firm. You really need to check it out. Like I say, it should be up and running the next day or so at www.dlblain.com. It's visually striking. We hired some professional folks to do it, and it's really great. So hopefully you'll head on over there and check out our new website. Should be up and running at least by Friday. It should be up and running. So on there on the website, we've got a contact form. If you've got comments or questions on the show, just fill it out there and send it to us. It'll generate a message. You got topics that you'd like to hear on the show or questions you may have, go to the web, fill out the contact form. You can also email us directly at allthingsmoney@dlblain.com. And of course, our phones still work, which is 252-633-0107. Okay, so phone 252-633-0107. The email, allthingsmoney@dlblain.com. And the web, www.dlblain.com. Okay, I thought we would start off with a little bit of tidbit of news. It's financial related, maybe bleeds a little bit into the political spectrum, but there's been a lot of talk recently about the top 1%, top 2%, the 99%, a lot of the income inequality in America. Separately, we've been having this national discussion about health care, and it's a discussion that we have every day in our office with folks, that people even with several $1,000,000 saved up, if they were self-employed or something like that, the cost of medical care concerns them. With Medicare, you have some backstop, but long-term care if they have to go into facility, things like that. So this is a debate that we continue to have, and you get the impression that there's this huge crisis out there and the overspending on medical costs, and it just costs so much out there. And if you drill down to the data, this came out, this was, I didn't print the date out, this was a couple days ago in the USA Today, and it says that 5% of patients account for half of healthcare spending. That's right. 5% of the people obtaining care in the United States account for half of the health care spending. If you drill down even further, just 1% of Americans accounted for 22% of the health care costs in 2009, according to a federal report released on Wednesday. So this was back in 2009. We have 5% of the patients accounting for 50% of the cost, and 1% of the Americans accounting for 22% of the cost. So my point in bringing this up is whether you're talking about income or things like that or health care, you've probably heard of the old 98% rule. 2% of the people account for 98% of the work done, and it basically applies for everything. And here we see it in health care, that to solve the health care problems, I would stipulate that we need to focus on these 5% of the folks that are spending half of the money. that whatever procedures they're doing, whatever processes are taking place is just a tremendous, tremendous expense. So anyway, the story goes on to say that that's about $90,000 per person. U.S. residents spent $1.26 trillion in 2009 on health care. The 5% or 50% of the health care costs was about $36,000 each. So the majority of people that are going to the doctor and, you got the flu or you need a checkup or, my kids are always breaking their arms or, something like that, those costs are not what we're talking about. It's the people that go in and their hospital bill is $90,000 or $36,000. Now, I'm not saying they don't need whatever they're doing. I'm just saying that is what is driving this spiraling healthcare costs. It's not the average person going there. It's these select few people that are really driving up the cost of healthcare. It says the report's finding can be used to predict which consumers are most likely to drive up healthcare costs and determine the best ways to save money. That's my point, is that if you focus on, well, what are these 5% spending on, or what are these 1% spending on? In 1996, the top 1% accounted for 28% of the health spending. So that actually has dropped a little bit, which is good. About 1 in 5 healthcare consumers remain in the top 1% for at least 2 consecutive years. That's another trend, that the people that are in that percentile consuming the majority of the healthcare tend to stay in that strata for more than 1 year. In case you were wondering, as you probably figured out, they tend to be in poor health. Obviously, the author felt it needed to point that out, that these folks are in poor health. Elderly and users of publicly funded health care. So we see that some of the demographics of these folks using this health care, and that's where a lot of the effort should be spent to try to minimize the cost. Anyway, just thought that was, as we were talking about the past couple weeks, income disparity in America, we also see significant healthcare spending disparity. And so we're talking about nationalizing healthcare and everybody pitching in their fair share, so to speak. The reality is most of the benefits go to a very small number of people. Okay, let's talk about 401ks. Even if you are self-employed, well, self-employed can have a 401k, but even if you don't have a 401k where you work or you have a small business without a 401k, the lessons I'm going to talk about here are applicable to everyone. I want to talk about, it's been a number of years since the 401k was instituted, and I want to look back on the successes of that as well as some of the failures and who has really succeeded with the 401k for their retirement. So for All Things Money, I'm your host, David Blain. We're going to take a short break, and after a few messages, we'll be right back and start talking a little bit about 401ks.